So welcome to August 4th, 2020, Trinity County Board of Supervisors regularly scheduled meeting, and we will start out by having our Pledge of Allegiance. Supervisor Brooks, would you please lead us?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And we want to thank everybody that is on Zoom. We are trying something new today, so we're again having technical opportunities. And as we have been doing during this COVID emergency, prior to the public comment, we will have our COVID team come up and update us and share with us what is going on. Welcome. Good morning.
Good morning. Thank you, Madam Chair. Marcy Hudson, Public Health Nursing Director. I'll start with our testing numbers today. This morning we have tested, we have 1,183 negative tests. We have 5 positives with 4 resolved, 154 are pending, 2 currently in isolation, 1 currently in quarantine, 28 total quarantines to date. We are looking at always improving on our data that's public facing to help our residents understand the picture. What we'll likely be adding is a running total of isolations as well. I think it's important. We get a lot of questions about whether or not this illness has gone through Trinity County already in March. That scenario, although possible, is probably unlikely, and there's a variety of reasons for that. However, I'm not going to go into a lot of detail on that. I'll certainly address that as it comes up. Probably the best thing to look at is a combination of our positives, the numbers of people in isolation and running totals of isolation, as well as quarantine. I don't want to put too much of a high point on the positives because there are examples of positives that occur in other counties that impact us. They may be positive in another county, but when they come back to Trinity County, they'll be isolated in our county. So those numbers aren't necessarily correlated. You might see higher numbers of quarantines, isolations than you would to positives and wonder why, and that's why. Perfect example of that is inmates coming back to Trinity County that may test positive in the county that they reside in the prison. That's their address. And so...
Marcy, I'm getting notes that Marcy's muted. I'm sorry, Marcy.
No worries. Thank you.
Thank you.
Try it now, see if you can hear it.
Can you hear me?
Well, we can hear you, but I
Oh,
don't know.
It's a Zoom that could not.
Oh.
We can hear you now.
Okay, great. Should I start over then?
Yes.
Okay. Let me go through the testing numbers. 1,183 negatives, 5 positives with 4 resolved, 154 pending, 2 currently in isolation, 1 individual currently in quarantine, and there were 28 quarantines to date. As I stated a moment ago, we are looking at improving our public-facing data to give our residents the highest degree of information we can and be as transparent as possible. One of the things we're going to be looking at is including a running total of isolations. We want our residents to look at not just positives, but the numbers of isolation, individuals isolated as well as quarantine, due to the fact that the positive rate and isolation quarantines are not directly correlated. You may have times where you have individuals that are isolated that are not related to a positive case in Trinity County. They may be positive in another county, come back to Trinity County. And the perfect example of this, as I stated, was state inmates coming back to Trinity County who are tested prior to release, maybe positive, and they come back. There's still some scenarios that may be included that I'm not addressing. We're trying to work out the issue with testing inmates and have those inmates isolate where they are rather than coming back to Trinity County. So I'll keep you all abreast of the data and how it's evolving and how to interpret that. The other issue I wanted to bring you up to speed on, first we'll talk about the testing sites and then some of the challenges around testing, as I'm sure you're aware of. Our residents can go to our trinitycounty.org website. If they click on the mobile testing link and click on more information, that will take them. They can click on the link that says monthly schedule for testing sites, and that's posted on our website. And I'm happy to answer any questions about that. I wanted to get to some of the challenges around testing to bring you up to speed. As I'm sure you're all aware, nationally as well as statewide, there are challenges around testing. One of the significant challenges is the long wait time. This is due in part to capacity at the labs, as well as a lack of rapid testing broadly available to counties, and also some delay in the delivery chain of specimens getting to labs from our Verily site. One of the things we're looking at is it more expeditious to actually transport those specimens from Verily sites to the airport in Reading where FedEx takes off to take those? Otherwise, they're transported by ground from us to that site in Reading, and for whatever reason, there's a delay in the reporting. However, I want to be clear that we've only seen an improvement in the one time we took them to the Reading Airport. Those results came back within 4 days. So we're not sure if that's just a fluke or if that is indeed a way to address this problem while we're trying to shore up other areas. One of the other areas we're looking at is looking at transporting or shipping tests to the San Francisco lab, public health lab, that's available to run many tests for several counties. I'm sure you remember Governor Newsom discussing that several weeks ago. We're also looking at our Shasta Public Health Lab, which we utilize. It is our public health lab, as well as a handful of other counties, and so we're looking at getting a good idea of how many tests they can take for us. The reason we're really concerned about the turnaround time is that we have, in one particular positive case, by the time we got the results, they would have already been out of isolation. That is a significant problem. It is not just a problem in Trinity County, this is a problem with many counties. I've heard on many calls with state health officers and public health directors that they're facing the same problem. That really renders contact investigation useless. We still do it to try to identify where the person may have got it and to try to ensure there's not community spread, get people tested that have been in contact with the positive, but you can see why it creates a challenge. The other important challenges this creates, and the reason we need to be able to work with the testing task force in California and our partners, is we've stood up a task force for jail testing staff on a regular ongoing basis and inmate testing. We're looking at partnering with SISQ. They do their jail health in their public health department, and they have nurses that will come and assist us. We're in the early stages of that planning. We've set up a task force with the schools, to meet regularly, weekly, as well as our MAC meeting to coordinate with partners. The school task force will be looking at the regular ongoing testing of teachers and staff as a surveillance mechanism to capture when any individuals are positive and how to respond to that. The school is, the health officer and myself are very concerned about schools. There is no appetite to keep kids out of school in our rural community. it's very challenging for them to be out of school. It's going to be challenging for them to be in school. We want to reiterate how important it is to have strong mitigation plans in the school, and we are working with the school leadership to do that. We are also working with the hospital to continue testing of skilled nursing facility residents, hospitalized patients, and we're working with hospital leadership, Aaron, Dr. Harwood, and Belen, to address rapid turnaround for testing of surgical patients. You can imagine waiting for a test 7 to 14 days on a surgery patient is problematic and primarily useless in that scenario. So we're also working with the hospital to be able to do that. We transport specimens down to Shasta Lab. We will do that with those surgical patient tests as well. The only last thing I wanted to mention, again, I feel remiss if I didn't do this every time I'm up here, is to once again plead with our community members. Every single individual in Trinity County has a responsibility not only to ensure schools open and businesses open, and that we can prevent the spread of this virus in Trinity County with all the challenges we're facing around testing, around potential surge of our hospital. We know from experience that these simple things work. Wear a mask when you are outside, when you are inside, within 6 feet of people, especially if you're inside, because the circulating air can carry the virus if there's not sufficient air exchange with the outside or a filter. Please, businesses, adhere to the guidance that the governor has set out. Bars, restaurants, I can't say that enough. Simply washing your hands on a regular basis. We can't emphasize that enough. We all want our population to be protected, and we want to get back to normal. We can see all around us what this looks like. That's all I have. I'm happy to answer any questions. I know Christy's going to talk a little bit more about businesses and what we're doing to assist them with compliance.
Supervisor Groves?
I don't really have a question, but I do have a statement for you that I went down, I drove past the testing down at the Performing Arts Center, and they looked bored, and I said, well, I'll just go down and get tested. And I didn't have an appointment, I forgot that you had that. But they were very gracious, and they took all the information and went through the process. And I just want to say, for people and that it took 20, 25 minutes. It's not painful. It's not a big deal. They're very nice and helpful to you down there. So don't be afraid to be tested. And thanks for those guys doing good work.
Thank you so much, Supervisor Groves. We really appreciate it. It means a lot to hear that coming from our supervisors. Just a caveat, people can actually get a same-day appointment. So we have people assisting them and enrolling. They create a pseudo Gmail account, so people don't even have to create their own Gmail account. It's just for that purpose. So thank you so much.
That's what they did for me, and they took me right in. So
Awesome. I'm so glad to hear that. Our team has worked very hard on that.
Supervisor Groves?
I do. Hey, thank you for addressing that gap problem between testing and results back. I know we talked briefly about it last meeting, so I'm glad you're pursuing some avenues that will help with that. And, maybe you can clarify something for me. I'm a little confused. All of you went through the trouble of the whole attestation process, and we were able to open. I believe that was late May. And I don't believe we skewed off of those numbers that you laid out, or your departments laid out. But now we're in this one level where restaurants have to serve outside, straight bars are closed. I think those are the two main ones. Certainly we're not anywhere near having group functions, and so I do understand. I mean, has the governor come out and asked why counties who are adhering to their attestation are still having to go into this new mode? And being in the new mode, what are the benchmarks to put us into the state monitoring phase, which we want to avoid? So can you address any of those?
Sure, let me start with the first question. So the first question regarding the attestation, back when, before we had continued rising cases in California and deaths, when you look over the last 2 weeks, 3 weeks, a month, and look at the death rate in California and the number of cases in California and all around us, as the cases continue to go up exponentially and the deaths continue to go up, the governor, rightly so, stated that all counties in California will do the following. So with that said, that's where we are with the closures. Regarding the second question about the conversation, whether or not there are, let me make sure I understand your question, Supervisor Morris, is there any discussion about counties that don't have, no, you asked about, I'm sorry, you asked about the monitoring list. Is that correct? What data we have to get on the monitoring
Well,
list?
we want to avoid that list, and I want to make sure, we're not close to those benchmarks.
That's exactly what the health department does every single day, is to keep us off of that list.
So is it a matter of cases? I mean, I think the public is concerned, because I understand if we do get on that list, schools also close.
That is not actually correct.
No?
So there are nuances to this. The monitoring list is you have to exceed a certain positive case rate, right? So you have to exceed a certain case rate over a period of time. So you have to hit a threshold of cases, and then you have to stay there for 3 days. That gets you on the monitoring list, for example. Now, to get off of it, you have to decline and maintain that case rate. With regard to closing schools, there's a little bit of a difference between the way schools are handled and the way that businesses are handled. There's a number of caveats to the school closure. I don't have those memorized, but for example, elementary schools, if there are, any school, if there's 1 or 2 cases in the school, so there's a threshold for how many cases in the school, how many cases in the district, that guides when we would recommend closing schools. There's a waiver for elementary schools, so that's a component in that mix of the health officer allowing a school to stay open under a waiver in the midst of spread and what that looks like. Certainly children that are positive or at risk because of chronic health conditions, they would have to be excluded from that situation. So there's a number of nuances, and I hope that answered some of that question for you.
It does, thank you.
Supervisor Finley?
No.
Do you have any question? Is Supervisor Brown join us?
It will be joined as well.
Okay, so, thank you, and one quick comment, and perhaps Ms. Hamilton can clarify this. We were on a CAP board meeting, it was last week, and I believe it was Elizabeth Kelly from another county that we CAP. The county she represents made the naughty list, and she was informed that, and please follow up on this, but my understanding is that once you make the naughty list, you will not come off the naughty list. So that might be something you want to look into. The pooling data, we were going to begin doing small pools of people. I was wondering if we have done that and how that is going to expedite the time. And then earlier today, so you might not have gotten it yet, Mr. Olmsted, who may or may not be on the line, I would like to find out. He had some questions regarding understanding the website. So if he's on, I'll have him address that. If not, I'll review his questions. But the pooling multiple people at one time, have we begun that, and what is the success of that?
That is not available yet through our Verily testing site. That the pool test is offered, it's my understanding, it's offered by a specific lab, and so far And we ask this question almost every day. We keep our fingers on the pulse of all those threads, but it is not available in that testing site yet. And that's, unfortunately, that's all I know, but as I know more, I'll certainly let you know. I'll update you every week.
That would help our timeframes, right?
Yes, it would help some. It would help some because it's a small pool, but it would increase it. Yeah, it would, depending on where the chain breakdown is and what's causing that. As I said, there's a few places that this is impacting testing turnaround, but pool testing is definitely one that will help in lab capacity. Yeah.
So is Rick on Zoom, or can you tell? I'll just go ahead and read it. It's actually easier because he took like cut and paste. So this is his comment. See there? Okay. The stats on the coronavirus are getting confusing for me. Maybe you can help clear this up for me. First, according to the chart, we have 5 positive cases and 4 resolved cases. So that means 9 total cases, right? Question mark. Second, 2 in isolation and 2 in quarantine. So that means 4 more cases, which bring a total of 13, right? Question mark. Third, does isolation mean they have the virus and are they already counted in the positive? Fourth, quarantine, does that mean they have it and they are counted as well? Question mark. The terminology of the chart is what is throwing me off. The reason for the question is last night, 8/2/20, on the new Action News on 7 at 600, showed a map with 9 on our county map. Now there is a website that is COVID-19 alert, coronavirus disease in Trinity County, California, and they show 6 cases. Now our chart as of today, that was early this morning below, shows 5 cases. So help me in this dilemma. So some of these questions, I think he laid it out really good. I get as individual questions, and so I thought while we're on Zoom, I know there was a lot in there. If you could address them, I did address them on an email back earlier, but for the general population, can you explain how we have 5, that's the total, 4 resolved means those numbers, and I'll let you go.
Yeah, thank you so much. Thank you so much for that question. This is a part of the process. We rely on the public to ask the good questions like that, to always ask any questions of us, because we always learn. So one of the things I'm finding from listening to those questions, we're always looking at, is this really telling the public what we want them to know? Is that what this data is doing? We're starting to find out that that may not be the case. I can see where it looks like 9 total. It didn't really dawn on me until I heard it in the way he asked it. We will fix that. So there are 5 total positives, with 4 of those having resolved. So I think we need to correct that and make that a little more clear. With regard to the others, we may need to put out a press release to bring people along and remind them. So let me just reiterate here. Quarantine is for people who are not positive, they don't have symptoms, but they've been exposed to someone. So that's what quarantine is. You can have a large number, and you will with this virus. You could have 10 quarantines to 1 positive, depending on what they were doing. So there will not be a direct correlation for every 1 positive, you'll have 1 quarantine. So that's quarantine. Isolation is a little different, but may not correlate. Isolation is for people who test positive or who have symptoms and have been exposed. So we want to isolate them. It's a little stronger than quarantine. They must stay home unless it's an emergency. Those individuals, you could have a number of isolations and 1 positive, because we're only counting right now lab confirmed positives. So you could have a lab confirmed positive, but you could have someone who's not tested, who has symptoms that we're isolating. We're not technically calling them a positive because they haven't been confirmed by a lab. Now, the other thing we're looking at though is, do we want to follow suit with other counties and count presumed positives? Which is, they have symptoms, they're not, for whatever reason, going to test, don't want to, for whatever reason. You can also use presumed positive in the absence of a lab confirmed test as a case definition. So we're looking at that now that we're getting larger numbers and we're seeing some confusion. So we're going to look at how we put that data out and maybe explain it a little bit better. But you will not see a direct correlation necessarily with the positive cases and isolations and quarantines. You want to take all three of those in the context of the virus activity in Trinity County to look at what's going on, because whether it's quarantine, isolation, or positive, all of those categories mean that the disease activity affected those persons at some point somehow.
Thank you.
I hope that helps.
It does, and where would the public be best to email any questions specifically on COVID? Where would you like to instruct them on Zoom to go to?
Yes, I'm so glad you asked that, because I tend to not want email to myself directly because I don't want to miss it. The best way to do it is through the trinitycounty.org website, and I think I'm going to ask Christy to explain the link because I'm not sure I'll do it well enough, but that's the avenue to email. Those come directly to me, and they're alerted in a way that I tend not to miss those. And I want to reiterate, that's so important. We really want our public to do that. That's how I get a lot of intel and what changes our policies and the way that policies around data and things like that, not the way that we respond to an illness, but also with what's going on in the community and how we can message. So that is so important.
Well, I did forward this from Mr. Olmsted, so you'll be able to.
Terrific.
Yeah, he did a really good job.
Yes. Yes, and the Action News piece, we know they misreported, but again, it's on us to look at, okay, people are misreading the data we're putting out, so we need to correct that. Yeah.
Thank you.
Thank you. Steve, thank you.
Supervisor Brown has joined us also.
Good morning, Supervisors. As you know,
Good morning.
Good morning.
Good morning, Don. As you know, as we go into several months of COVID response, a lot of our businesses are struggling, and it did not help that we had a bad news story throughout California telling some businesses that they could reopen when they were not allowed to since our last board meeting. And that made it really hard on those businesses because they got their hopes up, they started preparing to open, and they got the call that they were not allowed to. And from that, I really want to remind the public that it's county specific. I mean, we're being ordered statewide, but always check with the county first. Also, from this, we've been taking a multiple prong approach to outreach, education, really trying to get information out there to businesses. We had a team out doing these surveys and kind of telling us where we stand as far as businesses complying with the COVID masking, social distancing, etc. We felt this was really important because we were receiving a lot of complaints from many people that were directed at certain businesses. We didn't think we'd get an overall picture without going to every business and doing that survey by a neutral party. From that information, we were really able to figure out where those hot spots of non-compliance are, and that was really good information. As you know, COVID-19 is a very divisive issue in general, and we have both sides of the public complaining that they're closed and they don't think there should be any regulations or any mitigation measures. And then we have the other side that wants us completely closed down, no mitigation measures, just everybody closed. And I want to reinforce that we really need that middle ground. We want to stay open, but we got to wear our masks. We got to do the social distancing. From this standpoint, we've been working closely with several, we've been working with the chambers, working for joint messaging. You guys will get to see that in the newspaper. That's a big thank you to HHS on that. And I just really want to push that we're trying all these different ways, but it's not exactly working. And we're going to have to start trying other options. And we've been handing out masks to every business, handing out hand sanitizer, going down these surveys, reinforcing, educating, promoting. So we're trying every way, but we are still failing to get compliance in some areas and some businesses. So just wanted to tell you guys that update, kind of give you some information. I'm sure you guys hear the same complaints as I do, and because of that, I'm forthcoming in how I have been approaching it.
Any questions?
Yeah, thank you. I know it's been ongoing for all of you, and is Christy getting any extra help on the street? I just feel like you work 24/7, but I could be wrong. Hitting all the businesses and trying to follow up on all the complaints. So thank you. And is your approach of warning businesses, and then is there another level you get to take it to if they're just not complying?
Yes, and we've tried education and outreach, and we're really pushing that.
Mm-hmm.
But if we don't start seeing some results, that things will have to change.
Because I do get complaints from other businesses who are complying, and of course, saying so-and-so is not.
And it's not fair to the people that work there, because if you walk into a business and you're not wearing a mask, you're not protecting those workers.
Right.
And we need to care about each other as a community, and it's very important.
All right, thank you for your work.
Supervisor Brown, do you have any questions?
No, I have no specific questions. Yeah.
Well, I want to tell you that I was in attendance at the Trinity County auction, and I'll talk more about it later in the reporting out, but you were mentioned and in a very positive way, and the youth that attended and showed, the chairs were spaced out, there were masks on every chair, people were very cognitive, the auctioneer was very polite in his broadcasting, and they recognized you in a positive way multiple times, and just your availability to be aware of the importance of that for our county. And it was more than just the financial benefits. Our youth have been, they've been deleted from their proms, so many things. Some of these kids were going on to college, they're not going to be able to recapture. And so that day was really special, and you were recognized in your part on behalf of Trinity County. So you should know that, and you should be very proud of yourself for the measures that you took, were recognized, and they were abided by. So thank you very much on behalf of the FFA and 4-H and all those in attendance. We really appreciate it. Thank you. Yes.
Madam Chair, on the chat line, we have somebody saying that they can't hear us very well and cannot especially hear you.
Okay, well, earlier I was talking too loud, so.
And then we also have another question, that somebody that got tested, and it took 6 days to get it back, but then wanted to get tested again, but wants to know why they can't do it for 6 weeks.
So is that a Marcy?
That's a Marcy question, and because you brought that part up, I just wanted to bring up that on the main website, I'm getting feedback, sorry. On the main website, you can go and click questions, or you can go directly to reopenbusiness@trinity.org and ask any question, and if I can't answer it, I will forward it to public health.
Thank you. Marcy, you want to come up and answer that? I'm sorry, Supervisor Burrows, could you repeat that?
This is somebody that got tested. It took 6 days for them to get theirs. Says it wasn't ideal, but it was fine in the process. I'm doing it again this week, about 6 weeks later, because why not? About 6 weeks later. Oh, I'm sorry, there wasn't a question.
That's okay, but let me just, because I was prepared for this, I wanted to just share that persons can get tested through our Verily web test drive-through site. As many times as they want, but they can't get tested before their results come back from the current test. So,
Is there any delay once somebody has been tested positive? How long, is there a specific time frame that you recommend waiting till they're tested again? I think that was sort of the question that was there.
so that's a little challenging to answer, because if they've tested positive, there's no indication that, we don't really know yet if people can be reinfected. And so if somebody tests positive, there's a time where where it will still show up positive, and depending on the test. So I'd have to know more about the specific scenario, that someone who tested positive through a molecular PCR, the one that determines if you have the bug right now, the virus. Certainly serology testing would be something someone would do later on if they were positive, when that becomes available. It's not broadly available yet. So I hope I answered that to some degree.
To some degree, thank you.
Yeah, I would need to know more about why someone who's testing positive with the virus is going to test again if they're concerned they're reinfected. So that would just be discussions we would have and see what the recommendations are on that.
Thank you.
Yeah.
Is Ms. Hamilton going to come up? No. Dr. Jones, was there anyone else on the team?
Yeah, we have someone else, so Susie Coco's one to talk about the resiliency portion of this. So I think she is on Zoom with us. You up there, Susie?
I'm looking at her.
Ms. Susie, unmute. COVID update.
Yeah, she's talking, but we can't hear.
Susie, we can't hear you. Try your unmute.
No, she did away with video.
Susie, we can hear you on the phone. Can you hear me, the board? This is Margaret.
Yes, Margaret, we can hear you. You coming in loud and clear.
Okay, we can hear Susie. We can hear Susie on the Zoom, so I'm wondering.
So we will have another challenge for today. We'll see if we can meet it. But Susie, in the meantime, do you think you could call perhaps Dr. Coons and he can hold your phone up to the microphone? He's waiting for you to dial in. We're just gonna politely wait for you, because we know you have good information. Thank you, Miss Susie. If you could start from the beginning.
Sure, can you guys hear me?
Yes, we can. Let's do a check to see if people on Zoom can hear you. We're getting a little feedback.
All right, if she could speak, I'll let you know we can hear.
Okay, good morning, everyone. This is Susie Cochran.
She can't be heard.
Let me turn them both on. Okay, hopefully this doesn't create chaos. Can everyone hear me now?
The board can hear you. Ms. Long, we're getting a lot of feedback.
Yeah, when you talk, it feels nice.
Yeah, when the board talks, we get feedback, so we're gonna turn, we can't turn it off because we'll just step away from our mic.
Is your Zoom on your, you muted on your?
It's on Zoom, on mute and the lights on,
It must be hers.
just to her.
So do you prefer that I mute myself on Zoom?
Yes, please.
All right, good morning, everybody. I will preface this, if you have any questions about what I'm saying, please reach out to me via email. Susie Calkins, Grants Coordinator, I want to give you a quick update on COVID-19 response as it relates to economic development. A couple months ago, I was approached by Dr. Coons and several board members at different times about some economic development relief for those businesses who were affected by the shelter-in-place order and business closures, as we know, off and on, keep coming back and forth. We wanted to implement an economic development package which was very simple and easy to access for businesses, quickly get the money out into the community, but as I have come to learn, this CDBG, which is Community Development Block Grant funding, is not going to cooperate with our local need to make it quick and painless. We have to have these loan dollars underwritten, and I'm currently waiting for the Superior California Economic Development Department to give me a cost estimate on what it would take for them to serve as our underwriting agent. The application for the COVID Economic Development Relief money is due at the end of this month. I really wanted to have it already out in the hands of the businesses, but what legwork we are doing now is set us up for round two, so round two should be much quicker to get out and apply for, or apply the exact opposite, apply for and get out. So I'm here to report. I apologize for the delay. Unfortunately, requirements and hoops that we have to jump through are extensive. I'm working on it as quickly as I can, but relying on other folks and their pieces to the puzzle, and many folks have been on vacation, which makes it difficult to get things done timely. So when it's all wrapped up and the application is submitted, I will get back to you. The turnaround from there should be quite quick with the contract and funding to quickly follow behind that.
I think we're gonna have the board email you the questions if they have any, just because the technical obstacles that we're having with the audio. I appreciate your update. Thank you for all you do, Susie. I know you're working hard always. Thank you.
People on Zoom have issues hearing her,
We apologize for those on Zoom that we are having our challenges today, and so we appreciate your patience while we continue to navigate through this COVID situation. So does that conclude our COVID presentations?
It does, thank you.
Okay, thank you. So, well, we'll do public comment, and then public comment. This time is for information from the public on matters not appearing on this agenda. All comments are limited to 3 minutes and must pertain to matters within the jurisdiction of this board. When addressing the board, please state your name for the record and address the board as a whole through the chair. No action or discussion will be conducted on matters not listed on the agenda. However, Go ahead. However, the chair may refer the subject matter to the appropriate department for follow-up or schedule the matter on a subsequent board agenda. So at this time, we'll open it up to the members of the public that are present, and then we will go to Zoom and then the telephone. If you're on the telephone and Zoom, you will be reminded that you have 3 minutes. If you use profanity, you will be terminated immediately and you will relinquish your time. Is there anyone in the public?
I'm sorry, I'm trying to know if we can do it prior to but county council had an item they want to bring forward. Do we do that before public comment or?
As far as I remember, it's right prior to consent unless somebody wants to correct that, the subsequent, but I'm open to doing it
I
now.
just wanted to make sure we weren't going out of procedure, so thank you.
Ms. Long, if you're on the phone, would you
No,
like?
thank you, Rosa.
Do you want to do the subsequent prior to public comment or right before consent?
I prefer to be done before consent. I think I don't want to interrupt public comment.
Okay, thank you. Okay, so we'll resume back with the public that is present in the board room. Is there anyone here? Not seeing any, we will go to our Zoom. Is there anyone from the Zoom? Tina, Luke, to you. We're not seeing any hands up.
There's a Diane requesting public comment.
Okay,
I'm
Diane?
requesting public comment.
Diane?
Can you hear me?
Yes. Yes.
Thank you. Thank you, Diane Richards from Facebook. I wanted to comment on the COVID situation, but I don't want to use my time up unless I can get my comment here. You did not open it up to the public comment on that before you moved into public comment, general public comment.
That's correct. It's in the general comment and you have 3 minutes.
But there was no option for the comment on COVID report.
That goes in public comment for the general. We put the COVID first because that answers a lot of questions. But the public comment period is for COVID and whatever else that you would have to address. There's no specific
Well,
COVID.
I misunderstood because it's on the agenda, so we're supposed to not comment anything that's on the agenda.
I understand the confusion. It's a presentation.
Sorry, Bob.
Go ahead.
I've
Go ahead.
misunderstood all these years.
We're going to restart your minutes. We're going to restart your minutes, and so please begin.
All right, thank you. This is Diane Richards from K-Port. This is regards to the legal case, Heaney versus Trinity County Board of Supervisors, Keith Rose, Judy Morris, Carl Fisher, William Burton, John Finley, and Doe 1325. The counsel for Ms. Heaney contacted County Counsel Amanda Erkhammer to negotiate a settlement over a month ago. The County Counsel refuses to return the call, a highly unprofessional lack of duty to our clients, you, and the people of Trinity County. County Counsel Margaret Long stated in the declaration that she told the board that the county owed supervising generally a legal defense because under the law, he was being sued in an election contest for something falling under the normal course and scope of his employment. Running for political office is not a job duty, it is a personal choice. He was sued individually, not as a supervisor. I believe until the court will find that county counsel's opinion was wrong and require those who voted for the payment of the legal fees to reimburse the county. That means the financial liability and legal consequence that your counsel will not be held responsible for, but you will. Additionally, will your legal fees be paid by the public first once you leave office, as this case strikes through the justice system? Don't you think it would be wise to seek an independent legal opinion before spending more county money on this case? Suppose your doctor tells you your toe is infected and your entire leg must be amputated or you will die. How many of you would seek a second opinion before acting? Seek a second opinion now before continuing with this lawsuit. There are literally dozens of political corruption cases involving county supervisors that had to serve prison sentences, involving the misappropriation of funds, public funds, ranging from the illegal use of staff time to over $800 million as in the 8-year legal saga of San Bernardino County, the criminal case of 29-count indictments against the Board of Supervisors. I urge you to do your due diligence as representatives of the people of this county. Seek outside, unaffiliated counsel and expeditiously rectify this misappropriation of funds as you are the defendants in this case. The county council has a vested interest to support her own prior opinion, but it does not serve your interest or that of the people. I request that this letter be entered into the official minutes of the Board of Supervisors meeting today, and I just sent everybody a copy, including your CAO. And as to the COVID, I'm not sure how many minutes I have left. I think it's very important for the public to know that anyone familiar with coronaviruses, which I am, I've studied it in zoology and biochemistry, it is transmitted through fecal transmission. So that's why it's very important to wash your hands. And when you go to the bathroom, close the lid of the toilet before flushing so that fecal matter is not sprayed in the room. Wearing a mask, there is no study.
Diane, your time is up. Your time is up. Your time is up.
I'm sorry, I couldn't see the timer. Thank you.
Okay, thank you. Anyone else on Zoom? What was the name? Sydney? Cindy, I'm sorry, Cindy. Cindy? Is she talking?
Yeah, she's trying to talk, I see her mic.
Cindy, we're not hearing anything in the board, is it? Cindy, we're not sure why we're not hearing you. Is she writing in chat? So, Ms. Tina, Clerk of the Board, Deputy Clerk of the Board has just chatted to you. If you could respond to her in the chat. I'm sorry, Cindy, we're going to go ahead and move on. Please email your comments and we will try to respond to them, and if it's appropriate, we'll read them at the next board meeting. I apologize. Tina, is there anyone else?
Cindy says she can't get the audio to work. Can she type it?
Cindy, can you, if you have a phone, can you just, there's a phone number, you can just call us. And we'll give you a moment to try to do that. So is there anyone on the telephone lines that has been waiting? Okay, Cindy, we're going to have to go ahead and move on. We're getting close to the 10 o'clock. So prior to consent, I am going to try to keep consistent with Darrow and report out on items from July 21st. Item 6.1, no reportable action. Item 6.2, evaluation was held. 6.3, direction given to negotiators. And with that, now I would open up to consent. Are there any subsequent items?
Thank you, Madam Chair. I do have a subsequent item I'd like to bring.
Please go ahead.
Thank you. This is an emergency item. The topic is significant exposure to litigation pursuant to Government Code 54956.9, subsection B, number of cases. And the information regarding this exposure to litigation came to the attention of the county after the posting of the agenda and does require immediate action before the next board meeting. As a result, I request the board to vote to add it as an emergency item.
And this is be closed session, correct?
That is correct.
Thank you. So moved.
A second.
We have moved by Supervisor Morrison, second by Supervisor Finley.
Supervisor Finley?
Yes.
Supervisor Morris?
Yeah, yes.
Supervisor Groves?
Aye.
Supervisor Brown?
Aye.
Supervisor Chadwick?
Aye. Moving into consent calendar. These items include routine, non-controversial matters and will be acted upon by the board by one roll call motion. A member of the board, staff, or public may request an item pulled and considered separately. Does anyone from the board have any items they would like to pull?
No, ma'am.
Yes, Madam Chair.
Yes?
2.7.
27. Anyone from staff? Is there anyone on the line that from staff that would like to pull an item? Okay, now public, is there anyone from the public? Tina, are you seeing anybody? So we're not seeing anybody, so we will bring it back to the board, and I would entertain a motion.
Motion to approve as presented.
Second?
Supervisor Groves?
Aye.
Supervisor Finley?
Aye.
Supervisor Morris?
Yes.
Supervisor Brown?
Aye.
Supervisor Childs?
Aye. Supervisor Brown pulled item 2.7, clerk, recorder, assessor. Acknowledge signature verification certificate for Trinity County commercial cannabis tax petition and pursuant to California Constitution Article X111 or 13C, Section 2, and Elections Code 9118, parentheses B, submit the ordinance without alteration to the voters per Election Code 1405, unknown fiscal impact. Supervisor Brown.
Thank you, Madam Chair. Due to my conflict of interest holding a county cannabis permit and a state cannabis permit, I will be recusing from this item. Thank you.
Thank you, Supervisor Brown. Please just stay close and we'll let you know when we are done with this item. Is there any members from the public that wish to speak to this item? Seeing none, we bring it back to the board. I'd entertain a
Motion to approve as presented.
Thank you.
Second?
Supervisor Groves?
Aye.
Supervisor Finley?
Aye.
Supervisor Morris?
Yes.
Supervisor Childs?
Yes. Congratulations.
Chief Tax Chairman, move back.
Supervisor Brown, if you're there, we are concluded with that item. Would you like to join us?
Yes, I'm done. Thank you.
Thank you. 10 o'clock. 10 a.m. Public hearing, solid waste. Item 3.1, conduct a public hearing to consider adopting a resolution which confirms the 2020-2021 delinquent list for the solid waste parcel fee and hear any objections or protests to the report. No impact to the general fund. Any changes made to the report will impact the solid waste enterprise fund. Good morning.
Good morning, Madam, members of the board. Diane Rader, Deputy Director of Solid Waste. This is our final public hearing for the year for the upcoming parcel fee for 2021. It's to adopt the delinquent list, which are all unpaid bills that from the billing that we sent out in April. We've extended as far as we could to take payments up until yesterday, actually, to try and get everybody we could taken care of off the list. So we have, unfortunately, I had to bring a hard copy of the delinquent list, and also there is a supplemental list, which are payments that we've received and are holding, asking permission to deposit so that they can adjust to the delinquent list. And I think that's it. We've tried to resolve any problems that have come to us, and I'm not aware of any more, but it's a public hearing for taking any more comments.
Thank you. Supervisor Groves, do you have any questions?
I just do have a question on your list that you handed out. On page 30, you have a running total for the previous 30 pages. But then page 31, it's a separate page not tied to these other ones for a different amount.
The last page is unsecured properties, which we cannot roll to the taxes. They'll have to be collected another way. if you look at page 1, then you have a total for the secured and then total unsecured.
I see.
And altogether, it's 204,000 at this point.
Thank you.
What?
Any questions?
Yes, did you take care of all my people in District 5? No? Okay, perfect. I'll wait for the calls. Thank you, Diane, so much
If
for
we,
for reaching out to
if people
everybody.
need to call and ask about things, then
Thank you.
we'll be happy to help.
Supervisor Morris? Supervisor Brown, do you have any questions?
No, I do not.
Okay, thank you, Diane. Anybody from the public want to weigh in? Anybody on Zoom? I think this is the first time that that's happened with solid waste since I've been on the board. So, thank you, Diane. So this is a resolution. I look for a motion.
So moved.
No, this is a public hearing,
Right.
To adopt a resolution.
Right.
but we have to close the public hearing. This is.
Okay, well, we'll close it, but I thought we were still adopting it, and that had to be done. Tina, help me out here. I'm confused. I thought this was a resolution that needed an action.
After we close.
Okay, so we'll close the public hearing, and now I would entertain a motion.
I'll second.
Supervisor Groves?
Aye.
Supervisor Morris?
Yes.
Supervisor Finley?
Aye.
Supervisor Brown?
Aye.
Supervisor Chapman?
Aye. Thank you for clearing that up, Supervisor Groves. Moving on to reports and announcements. Receive a report from department heads. Are there any department heads present? Thank you, Liz.
Good morning, Madam Chair, members of the board, Elizabeth Hamilton, HHS and LES Director. I am pleased to announce, and I wanted to share with you that we've done a recruitment and a selection for Deputy Director, backfilling my vacancy with my promotion. And so I'd like to announce that Mike Catoni, who's present today, has been selected to the role of Deputy Director for Health and Human Services. As you may know, maybe not, he's been with our agency for over 21 years and just brings a wealth of knowledge and historical knowledge of our department and community. And I'm just very proud of the work that he has accomplished in his time with us, and I couldn't be more pleased with this appointment, so thank you. Additional to that, I just want to give a public appreciation to our COVID task force. You know, week after week, listening to the updates that are provided by Marcy, Christy, and just the work that goes on through the weeks. And I just want to give an appreciation for all of that hard work, and an appreciation to the board for supporting us in our efforts and helping us remain compliant with the state requests. It doesn't fall lightly on me that there is contention between boards and county agencies throughout the state, and I just am very proud of the support we receive from you and our CAO, so thank you for that.
Thank you. Great report, by the way. Marcy, did you have anything? No? Okay, is there any department heads on the line that would like to report out?
Tim Saxon, Sheriff, is on the phone. Can you hear me?
Yes, sir. Thank you for joining us, Sheriff.
Yes, I'd like to just briefly say that our jail construction is continuing. It's slightly behind, but things are going well considering with COVID and everything. We are exploring some payment options that we are bringing forward to the CAO's office, and we have a meeting scheduled in the near future with regard to how to fund our dispatch equipment. We had a little blip. Previously, I mentioned that we were hoping to have OES and the state pay for some of that equipment. That fell through. So we're moving forward and exploring some other options. It's not all doom and gloom, so I'm
really positive about what we may be able to work out. On another positive note is that this coming Saturday, we have 4 of our employees that are graduating the Siskiyou Post Academy. I've been reporting on this over the months. We had a brief hiccup on that due to COVID. They shut down the academy for about 2 months. But finally, we're looking forward to graduation. 3 of those individuals will be sheriff's deputies and will begin their field training come Monday. And 1 of them will be a correctional deputy and will actually begin working on Sunday. So we're excited about that. And we currently have 2 sheriff deputy trainees that are attending the Siskiyou Post Academy. So in 6 months, they'll be graduating and beginning their field training. So we're excited about that. Do you have any questions for me?
Does the board have any questions for the sheriff? No. Jeremy, do you have any questions?
No, I do not. Thank you.
Thank you. Well, congratulations on filling all those slots, and we look forward to meeting the new personnel. Thank you very much.
All right, thank you.
Is there any other department heads? Okay, we're going to come back to receive a report from the County Administrative Officer, Dr. Coons.
Nothing to report, thank you.
Thank you. Do you want to mention anything about the fires or anything like that? No, this time? Okay,
Right
sorry,
now,
I shouldn't have sprung it
I was
on you.
hoping Ed would be here, he could give a
Yeah.
little more, but for the information I'm getting, though they're not contained, they're moving in directions that are not threatening structures or population. So we're getting constant updates from the U.S. Forest Service. Received another one this morning. I usually forward them up to the board when we get them. So though lots of smoke, it's not moving our way.
Thank you. Receive a report from members of the Board of Supervisors. Supervisor Brown?
Yeah, no out-of-county travel. Something I would like to announce, was a couple weeks ago, Bill Shiat with the CSAC Institute passed away suddenly, and I just wanted to share some words of thanks for having time in my life to meet him and spend time during the leadership classes I took. And I actually completed my leadership course of 8 classes and got my plaque a couple weeks ago in the mail, and Bill had signed it, and just a few days after I received that, I heard of his passing. Bill was incredibly supportive of coming into politics from my perspective, having no experience, and he was very encouraging to bring ideas to the table and to look for compromise and unity whenever you could find it. And again, I'll appreciate the exposure I had to him, and a big heartwarming celebration of life for him, for me. Outside of that, and I'm not sure if any of the other supervisors were going to report out on the livestock auction, but I had been in contact with some of the people who put it on, and I wanted to give a big thanks to Christy Anderson for keeping up with all of the COVID changes and helping the auction happen. They raised over $500,000 at this last auction, which is up by 30% from last year's auction. So I was really impressed with that. And the only other item I have to report on is actually regarding an item from the last board meeting. I've received a number of calls regarding the, and I'm looking for the exact item, if I can find it, but regarding the In God We Trust plaque. I've definitely received calls from people after they read about it in the newspaper concerning separation of church and state, to keep it short. So I would request that the item could be brought back for the next board meeting, and there can be further discussion on that item. Other than that, that completes my report.
Supervisor Groves?
Can I ask Jeremy a question?
Yes.
Okay. Jeremy, is that a formal request that you would like a vote on today? Or are you just requesting the chair to do that?
No, I would like to make that a formal request that the actual item be brought back for rediscussion, mainly because I've received at least 6 concerned inquiries about it. I feel that many people, I think, would have made a public comment on the item had they known about it and looked closely. And I think a lot of people just didn't know about it until after the newspaper article was done on it. So I would like to respect the concerns that I've heard and try to have a further discussion and dialogue on it before it is proceeded on any further.
So, I'm not sure of the procedure here. I guess I would second that.
I wasn't gonna need a vote. I was going to go ahead and bring it back as a request. So I'll bring it back as a request. I don't think we need a vote. So if you want a vote, we can take a vote, but I don't think anybody has a problem with reading.
If I can jump in and just give a little procedure.
Yes.
If a board member makes a request for an item to be agendized, the chair can make a determination to agendize it. If the chair chooses not to, then that's when you would have a vote to override the chair's decision to bring it back. But it sounds as if the chair is prepared to agendize it, and as a result, it will appear on the next agenda.
Thank you, Margaret.
Easy peasy.
Okay, thank you, Madam Chair, I appreciate it.
No worries. Supervisor Groves, do you have any?
I have no out-of-county travel, but I do want to have 2 items agendized, and I will be requesting a vote since one of those we requested already, and Madam Chair chose to pull it off, and that would be the opt-out, urgency ordinance for the opt-out in the Rush Creek area. And we had over 70 out of 80 landowners there request this item. This item was readied and put on the March and in May. Madam Chair chose to pull it off, unbeknownst to me. So I'm requesting that to be put on the agenda.
I'll support Supervisor Groves in that, or give you a second.
Do we need a vote? I believe he just made it official vote, so. Is it?
It's up to you.
I-
Are you going to agree to put it back on the agenda, or do you want us to vote
Well, I
on
think
it?
there was some misrepresentation, but since it's been moved to a vote, I have no problem with it as a vote because it was already moved to a vote and seconded. So procedurally, we'll just go ahead with that. Doesn't matter if I think it was misrepresented or not. So go ahead and pull the board.
Supervisor Finley?
Yes.
Supervisor Groves?
Aye.
Supervisor Morris?
Yes.
Supervisor Brown?
Aye.
Supervisor Chapman?
Aye.
Okay, and the second item is an opt-out in the Henshaw area, and that is not ready to go, but I would like to give directions to staff to have the ability to put that on the agenda when they have that ready to go. That would be up to the chair if she would plan to pull that off. I would have a vote on that.
So my understanding, so the board understands where I was coming from, after talking to Director Hunter, she indicated that all licenses were at full capacity, that there was a waiting list, and therefore the idea of putting an opt-out when we were over-committed on licensing seemed mute. So therefore, Director Hunter, and I don't remember, I apologize, Dr. Coons, I think we had a separate conversation on the whole thing, to have a a agendaized item that did not seem relevant, seemed a waste of the board's time, since there are no licenses available. And so it wasn't presented to me as a agenda item, there was a conversation. So I just wanted to make sure for the record that you all understand that. My understanding is that we're over capacity on the licenses. There is a waiting list. We want to have an opt-out, even though no one, we can continue to take licenses, I suppose. My understanding is that we're over capacity. So that's where that came from.
Instead of opting out or looking at something like that, I would prefer to have a presentation from CAO and from
Director Hunter. I agree.
regarding our ability to service our permits. And if 530 might be a bit too many, or possibly it's not enough, possibly we could service several thousand.
So would you like to have
I'm
this?
assuming we can only service 20 or 30 permits, and it's something we need to start looking at.
So would you like to have this presentation prior to agendaizing the opt-out, or do you?
Regarding Keith's agenda item, the first one for opt-out, that was presented back in May, and he's expecting his constituents are expecting some response on that. Again, I would like to see what the county can really service regarding permits and cannabis, and Director Hunter's opinion on that.
I think we need to get through the EIR first and see what that comes back.
Well, I
We've
think
been
we can
waiting
still
for this.
have a
We've been-
presentation on the capacity of where we're at and what we've fulfilled and how many are returning. And I do think that that presentation should be prior to, we can't make a decision without all the facts. So I
Okay,
would like to
that's
have
fine.
a
I'm up for-
presentation, but I'm
up for
okay
that.
if you want to do it the other way around.
Well, I will say, they are issuing new licenses or they're working on new licenses in my opt-out area. John, that opt-out area is in your district, and I just
Right.
found about it. I just want that to be a process to move through. It's your district, so I'll acquiesce to what you want.
I have no problem with opting out anywhere they want to. I really have a problem with how many permits we're attempting to service. And attempting is the word. We're not doing justice to our permits. Perhaps it's time to start culling them, bringing them down, looking for people that are more interested in providing a good product.
You will read in last week's paper that she is in the process of
Okay.
removing
Look at the
removing
paper.
people that have not met the criteria.
So, if if I'm receiving direction correctly, I will meet with Director Hunter and the CAO and see if Kim could present at the next agenda, and then perhaps the September agenda, have these items on the agenda if the board wishes to go that direction.
Yeah, as soon as Hetman is ready, especially with their archaeological problem or experiment, whatever's going on there.
So is that the consensus of the board?
I'm requesting mine to be on the next agenda.
Without the presentation first?
Last presentation.
Or you could put the presentation before the
Okay, well, I'll
item,
see
and it might
what
change the item.
Director Hunter's availability is.
I think she has a big full plate, and I think Supervisor Grove's item has been in the queue for a while. I don't see why that can't come forward if it's not already completed.
It is complete.
Then the other two items could come, I would say, at staff's availability. And I think she's working on quite a few deadlines at the moment, if I'm not mistaken.
So I'll meet with you and have this conversation. So Supervisor Brown, did you want to chime in on any of this?
No, okay.
I think that was, no.
No, okay.
Okay. All right, Supervisor Finley, Did I call you for reports?
Not yet, I have no
Still
unintended
on
travel, but
reports.
since Mike is here, I'd like to thank him for his work on the advisory board with PSA 2 and let him know that next year probably there will be an opening for the executive board on PSA 2, so you have your training in place. Sandy Bechtel will probably step down and 2 new supervisors will step up, so I'm planting a seed. Thank you, and congratulations, really congratulations.
Thank you.
And your work out in the community is incredible. Thank you.
Supervisor Morris?
No, nothing to report, just another congrats to Mike.
And congratulations. I didn't leave county. I did stuff over Zoom. Cap, Liz Hamilton was voted in, and she will be, I don't want to say replacing Letty, but she will be filling those shoes and greatly appreciated. And I was in attendance at the livestock auction, and it was just a remarkable day. It was wonderful to see so many smiles and the kids showing and everything. They didn't, you know, they were very respectful of the social parameters, but the youth were really delighted. And we had, I believe it was 30 and sometimes 32 virtual bidders. So that was a first for the fair. I hope that Miss Carrie Bailey will do a full report out on how we were able to negotiate and accomplish this feat, because other counties did not have this opportunity. So anyway, kudos to everybody, all the volunteers. Jeremy, who from the dairy store, was running IT in real time and just keeping everything going on live, and a lot of volunteers made it happen for those kids. So way to go for county in action. So moving on to county matters. These items include non-routine or controversial matters and are listed alphabetically by department. A member of the board or staff may request that the item be heard out of order. Clerk of the board, item 5. Anybody want to pull anything out of order?
Is 5-3 ready to go, or
I'm sorry,
is
couldn't you?
5-3 ready to go, or is that just going to be on Zoom? Shelley?
Shelley, are you on Zoom? Are you waiting out in the hallway?
She's on Zoom.
She's on Zoom.
Okay, whatever your
We'll just
pleasure
go
is.
ahead and go in order then.
Yes, ma'am.
5.1, adopt a resolution ordering a special election consolidated with the November 3rd, 2020 general election regarding the imposition of an additional half-cent sale tax for law enforcement within Trinity County. Cost of placing ballot measure on the November ballot is unknown at this time and is dependent upon the number of other ballot measures.
I can take this one.
Yes,
Thank you,
sir.
Madam Chair, members of the board. Yes, this is county-driven to ask the board to put on the November 3rd ballot the election to hopefully increase our sales tax by half%. It will generate somewhere around $550,000 to $600,000 that would go directly to law enforcement. Law enforcement would be Sheriff's Department, DA, and probation. What we chose to do for the distribution, if this is passed, would be use the formula that Prop 172 uses. We had a couple different options. That seemed to be the most fair of the distribution. So I think it's in here, but it comes out somewhere around a little less than 70% to the jail, sheriff, and then 15 to 14% to both the DA and probation. It would be a special tax, so it would require a 2/3 vote of the population to get it passed. So at this time, we're asking the board to consider placing this on the November 3rd ballot.
Any questions from the board?
Nope.
Okay, open it up for public comment. Is there anyone from the public that would like to make a comment? Anybody on Zoom? I hear something. Is that Jeremy? Okay, gonna bring it back to the board. It's hard to tell if someone's from the public. Entertain a motion.
Motion to approve 5.1 as presented.
Second.
Supervisor Morris?
Yes.
Supervisor Finley?
Aye.
Supervisor Groves?
Aye.
Supervisor Brown?
Aye.
Supervisor Childs?
Aye.
Thank you. You're welcome.
Item 5.2, adopt a resolution which amends resolution number 2020-057, which authorizes the elections official to conduct a special election consolidated with the general election on November 3rd, 2020, regarding the formation of the Trinity Life Support Community Service District and the imposition of a special tax for that district. No fiscal impact. Ms. Morris, are you taking it?
Yes, this is an amendment to what we passed at our last board meeting. People can hear me okay. They wanted to amend some language just to make it look clear. I think our staff from LAFCO also spelled it out quite nicely, what they're looking to do in terms of language change. And our staff says it's in alignment with our past resolution that we had in front of us last meeting. So that is what the life support folks want to do. I also want to thank the various staff who worked to get this on, because it has to get on today, so to make the November election. And I don't know if life support is on the phone or on Zoom. If they had any other thoughts. Kathy, are you out there? Okay, well, it's pretty self-explanatory. And other than that, that's kind of it in a nutshell.
Does any of the supervisors have any questions? Supervisor Brown? Do you have any questions?
No, I do not, thank you.
Thank you. Anybody from the public wish to comment? Bringing it back to the board.
I move to approve then.
Second.
Supervisor Finley?
Aye.
Supervisor Morris?
Yes.
Supervisor Groves?
Aye.
Supervisor Brown?
Aye.
Supervisor Childs?
Aye. Thank you. Human Resources 5.3 pursuant to Trinity County Code Section 2.60.410, parentheses A, authorize hiring candidate number 00405 as a Deputy District Attorney 2 at range M242, Step B in the District Attorney's Office, effective August 4th, 2020. Approximate cost and salary and benefits per month for a Deputy District Attorney 2 at A step is $9,965 and at B step is $10,386. And Ms. Shelley, are you on then?
Richard, you want to take this? See if I did Shelley, she was on just a minute ago, she just texted me. Just can't, we can't hear her.
Does she want to call you?
Yeah,
Call
call
in?
me then.
Oh. Shelley, we're going to have you call in, or Dr. Coons is calling you, I think. Sorry about the technical challenges.
Maybe we can get somebody to read some lips.
Hello?
Hi, Shelley.
On the phone, huh?
No, so we'll do it this
We
way,
can hear
sorry.
you on the phone.
No problem. Tell me when to go.
We're ready.
Okay, this is Shelley Nelson, HR Director, Trinity County. Sorry that my call in on the Zoom did not connect for some reason. I could hear all of you. So this particular item, the District Attorney's Office has been recruiting for a Deputy District Attorney since September 2019. We had a long-time vacancy that we've been trying to fill. The applicant that scored the highest among the interview panels meets the county's minimum requirement of 2 years work experience performing criminal law work. They have an additional 1 year of legal work experience. And because of the extra experience that this individual has, including positive reviews that we've received from reference checks, the department would like to offer above A at B step. The the applicant's education experience would prove to be an asset to both the office and to the community safety.
Thank you, Ms. Shelley. Is there any questions for Ms. Nelson? No questions? Opening it to the public? Anyone on Zoom? Bringing it back to the board.
So moved.
Second.
Supervisor Finley?
Yes.
Supervisor Morris?
Yes.
Supervisor Groves?
Aye.
Supervisor Brown?
Aye.
Supervisor Chadwick?
Aye. And with that, we are adjourned except for closed session. We will take a 10-minute break. Supervisor Morris?
I just have a quick comment. For next meeting, Dr. Coons, could you look into, it seems like we have a lot of folks who can't hear us, more so than past meetings, so just.
Daryl we tried something different today, and I think Daryl probably has some ideas.
Okay, just wanted, based on the comments I'm seeing.
Yeah, so we're adjourned, 10:32, yes?
Just real quickly, I'm confused. We have public that come into the boardroom, but I don't know how we pick the public that's allowed in. So.
We've only had public, and it's been in limited space, and it's who's here.
And they have an item.
Yeah, usually it's
They have an item.
members of the public that have something on the board, like the public that's here today had an item on consent. It wasn't, and we weren't asked any questions.
Afraid we wouldn't vote for it.
Yeah. Otherwise,
But
if they do show up for public comment, we can let one or two in at a time to make a public comment here, as long as they're wearing the mask and they follow our social distancing, and then they're supposed to go back out. The members you saw here today did have an item on the agenda. Otherwise, no, it's not open for general public.
So how does the public know that, do they request that of you, or that they can be in here? Or?
We can do that. Otherwise, usually they'll show up and they'll ask out front, and we'll have someone to stand out front, and I'll get their number, and they'll let us know, or we'll contact them as they want to speak.
And I had no problem one of the last times with Jordan, having him request it of you. He kept asking me, and I said, as chair or CA. One other thing, Chair, you have a subsequent item.
That's what I'm gonna ask.
If she can email it to you and you can read it and ask.
That's what I was waiting for this conversation to be done.
Thank you.
Margaret,
Shut up.
I would like you to inform me, because the subsequent did not come with any item number or wording. I know you read the codes earlier. If you would like to send that to me real quick, I can read it for the video. If not, if you want to read it over the Zoom or over the phone, then we can take a break and then go into closed session. Darryl, did you have something you wanted to add as well?
Relative to the public comment, Planning Commission has somebody sitting in the lobby to kind of meter people coming in and out, so they make sure there's not too many people in here at a time. So they get to do the public comment here, but they have somebody in the lobby managing that group of people who might want to come in.
And we've done that when there was a big
That's what
item,
the-
and
that's what the planning
going in the
commission did.
future, what I would suggest and what I have suggested is people email their supervisor, and that just like Mr. Umstead had emailed me those questions. I think it really helps because of the technical challenges that we have, plus they don't have to be exposed to any potential COVID. So I really do think that the emails are, for now, a real good way. So Margaret, I'm gonna go to my email. Are you there, Margaret?
I am, and let me read it into the closed session item.
I
It is
appreciate that.
significant exposure to litigation pursuant to Government Code 54956.9, subsection B, and the number of cases 1.
And are we calling this item number 6.1?
That'll be for Tina.
Okay, so when I report out next time, I just say the subsequent closed session item. Okay, so,
Thank you, Madam.
and I'm opening it for public comment. anybody on Zoom, so we will come back in 10 minutes to the closed session. Adjourned open session.